Changes are coming for Americans who rely on Medicaid for their health services.
But there are some things users can start doing now to get ahead of the changes. Dr. Jeffrey Sterling is a physician, as well as the president of Sterling Healthcare, a medical consulting and implementation firm. He's here to walk us through some changes. Thanks for being here.
Thanks for having me. It's good to see you both.
So what is happening in not October of this year, but October of 2026 that people have to be prepared for?
Well, actually, there's a lot, but there's a caveat that states can actually choose to expedite implementation of some of these things. So in some states, these things may actually be happening as soon as legislatures can get them passed.
And just to be clear, is this just Medicaid, not Medicare at all? Or?
Well, again, Medicaid and the Affordable Care Act. So the Affordable Care Act is Medicaid expansion. It's a good way to think of it.
Okay, so one of the big things is work requirement. Can you give us the details of that? Obviously, there's some people on Medicaid that are more, disabled than others, I suppose.
Well, the bottom line is that there's going to be a combination of a work requirement or a civil service requirement. You're going to have to get about 80 hours per month of established work at a rate equivalent to the minimum wage. So you're going to kind of have to make the minimum wage in the United States is $7.25 an hour. So you're going to have to prove that you've either made $580 or so per month, or you're going to have to prove that you did that amount of community service to stay eligible for Medicaid.
So, I'm sorry, will that be taken out of the money that you get for Medicaid?
Well, no, but again, there's requirements in order to...
Just you have to be doing
qualify.
it.
To qualify, right.
So, but let's be clear when that kicks in. So what happens October 26, 27, 28? Right. Can you tell what happens?
So real quickly, the first thing is that for immigrants actually are allowed to receive Medicaid currently. That's going to stop unless you are a naturalized citizen or if you have a green card, for example. As of October of 26, you will no longer be eligible for Medicaid.
Okay.
Okay? And the end of 27, first day of 28, there's a double whammy that's occurring. The first thing is that the reporting requirements are going to be dramatically enhanced. You literally are going to have to prove that you have remained eligible. So it's not that you were eligible or that if you forget, you'll get to go back and it'll be retroactive. You will now have to report twice a year, and you will have to be proactive to ensure that they have your information.
And so if you're an undocumented immigrant and you need health care, does that mean you go to the emergency room or?
That's a great question, because that's the big puzzle. That question has not yet been answered because the emergency department is the place of last resort. And there's a law called EMTALA, Emergency Medicine and Treatment and Labor Act, that actually says that we have to give you a screening examination at the very least if you show up to an emergency department without cost. It remains to be seen if that will still be the case, because the emergency department is still the most expensive portal of entry into the healthcare system.
Is there any chance any of this will change before it kicks in?
Absolutely. And that's why you want to sound the alarm for people that are concerned early on. They have to take the steps necessary to either make sure that they stay eligible or to protest and try to change things before they get implemented.
And if people want to find out, details or more information, where do they go?
Well, every state has a Medicaid line that you can call, and obviously there's a federal one, but people actually need to be proactive and to begin the process of calling those lines so that you can determine your eligibility, because those reporting requirements are real.
All right, for more information and resources, there's the information on your screen. You can visit jeffreysterlingmd.com.
And you'll help direct people to that information as well.
Absolutely.
All right, thank you so much.